In this chapter, we'll discuss implementing and evaluating learning. So the objectives explain the advantages and disadvantages of various educational methods and techniques, discuss the educational methods and techniques appropriate in the cognitive, affective, and psychomotor domains, compile a task analysis, list the ways in which instruction can be organized and sequenced, identify the purposes of an educational evaluation, explain several types of evaluation, prepare a lesson plan, compare and contrast formative and summative evaluations, norm-referenced and criterion-referenced evaluations, and reliability and validity, plan, implement, and evaluate an educational presentation for a specific target audience. And so the chapter starts off with this quote, "I hear and I forget, I see and I remember, I do and I understand." And so again, taking a look at how we plan learning and how we evaluate the effectiveness of learning, right, this will kind of play into that. So the first technique the book discusses is lectures. So this is a passive method of informing and transferring knowledge, and is our lowest level in the cognitive domain, though it is useful with a large number of learners. But again, there's no guarantee the material has been learned and remembered, and so we'll talk later about how we check for understanding and that the audience has actually retained that information. Next we have discussion, which promotes active participation by the learners, and this is done in smaller groups, so between 10 to 15 students. We recommend that we're sitting in a circle, so again, since we're having a discussion with everyone providing input, right, sitting in a circle and being able to see other group members is essential, but it is much more time consuming. So again, as you've increased the effectiveness though, what you now have is a problem with, which is it's more time consuming. So again, there's always a trade-off. Next you have simulation, and so this is things like real life situations, and these are active ways to develop knowledge, skills, behaviors, and competencies. And so this is scenarios, things like role-playing or critical incidents, or the book mentions an in-basket exercise. So for as a management activity, for example, how would you handle if you had this stack of bills, complaints, etc.? How do you do the invoicing? How do you deal with the complaints? But again, it's that actually putting yourself in that position of what you would be doing. So we have demonstration, where we combine knowledge and skill with cognitive and psychomotor objectives, where the learner observes the instructor. And so this is things like job instruction training. So again, if I was showing someone how to use a piece of equipment, or if I was showing someone how to conduct a lab experiment. So this is what you'll see, for example, in many lab-based courses where first the instructor will show you how to do something, and then you'll try and replicate it, or they may have left out a step and you'll see what the results are. Now there's also other pieces of technology that can be used alongside, so as it mentions in the last bullet point, which is adjunct to learning, so we can use things like computer programs, audio tapes, videotapes, podcasting, cell phone, video conferencing. These are all useful tools for learning, but by themselves they're not as effective. So again, we usually need to combine these, or these are supporting other learning methods. Now grad school is a little bit different, so as learners become more advanced, right, if something's intrinsic, if they're pursuing advanced knowledge, this is why you'll see distance courses, online, graduate school, etc. But again, it's usually not as effective with high school learners, earlier in college, etc., until people kind of become more routine and get more exposure. So looking at the cognitive domain, so again here specifically we're looking at knowledge, and so what we find here is that most techniques are effective, but there's additional factors in the learning in affective and psychomotor domains that will require the use of different techniques or more advantageous techniques. But even within the cognitive domain, there is an advantage to using mixed methods or multiple types of teaching. Now again, with the affective domain, so again, this is when you want somebody to appreciate or value something, so you're trying to influence or change a learner's interest, attitudes, beliefs, values. And so for example, in food, right, what we're talking about is, does somebody value choosing the correct foods, or do they value following their low carbohydrate diet or their low saturated fat diet? And so this requires ongoing contact with, again, multiple instructional strategies. And the other big one, though, is problem solving, but also modeling. So this is why you'll see so many different types of support groups. So this is for things like alcohol cessation or things like Weight Watchers, where again, so we have modeling from successful people, and again, looking at that problem solving. So the psychomotor domain, again, this is a physical task. This is doing something. So this is learned with direct experience, although demonstration can be useful. So again, I would show you how to use the meat slicer. You would then practice using the meat slicer on your own. The learner needs to practice the skill though, so again, they need to then try and use the meat slicer themselves, and they need coaching. So, position yourself this way, don't extend your upper body so far over the machine, that's dangerous. Make sure you're using this guard, right? So they get coached, they see somebody use it, and then they practice using the meat slicer themselves. Now, one of the things, I don't know if you've talked about it in the previous management class or you'll talk about it in the next management class, is a task analysis. And so this is a written sequential list of steps. And so it incorporates all the components for knowledge, skills, abilities, and conditions. And so again, many job-related tasks. So for example, in food service, involve the psychomotor domain, specific tasks, so cooking, prepping, etc. And again, we know that repeated practice improves those skills, which is why somebody may take more time when they first start working. But again, once they get used to, this is how you use this slicer, or this is how you use this machine, right, or the fryer, right, then they get much more efficient and better at it. So with job instruction training, we have a 4-step process with preparation, presentation, learner performance, and follow-up. And so again, when you put this all together, it's a pretty common sense process. So again, we have preparation, which is again, giving people out the information, putting the learner at ease. You have presentation, where you're then showing them what to do. Learner performance, they're going to attempt to do it. And then follow-up, right? So as they improve, they're going to need less supervision, and they're going to be able to perform the task on their own. Now looking at how we can sequence instruction. So again, we have progressive development of knowledge, attitudes, and skills. So again, there's different ways that we can present information. So we can go from general to specific, or we can go from a specific example to then a more general concept. We can go from more simple to complex, or we can go from something that someone's familiar with to then going to something that they're more unfamiliar with. But as we talked about in previous lectures, for example, if somebody has a frame for their knowledge, then we have this new unfamiliar information, we're able to then put it in the context of our previous familiar frame. We can also go based on the interest or the concerns of the learner. So again, especially with adult learners, right, they're there for a specific task, specific information. They're interested in something that they want to know, so we can use that to our advantage. We can go based on a logic or a logic progression, or we can go based on the frequency of use of information. And so that's one of the things you'll hear about. So for example, when we're doing education in the hospital, what's known as survival skills, where again, what we teach people is something they need to use most frequently and that's most important. So now, of course, once we've actually done the teaching or the instructing, how do we know if it actually worked? So how do we evaluate our results? So our evaluation is a systematic appraisal of quality, effectiveness, and worth of the educational endeavor. So what did we get out of it? Did it work? So we have to decide what to evaluate and when to evaluate it, but also how that evaluation will be done, as there's multiple types of evaluations. So looking at our measurement, our educational assessment, so again, we were concerned with collecting and quantifying data. And so what we're looking at, so the numbers of extent, degree, or capacity of people's learning. So again, we're looking at that knowledge, so what level they have attained, how much of it they've retained. We're looking also at knowledge, attitudes, skills, performance, and behavioral change. But again, our evaluation is based on measurement. So again, similar to setting these goals for clients, we want something that we can actually measure to evaluate. Now we also need to determine the purpose of our evaluation. So most of the time what we're thinking of with education is things like the effectiveness of the program or training, but in the workforce we may have other reasons such as quality control, planning and improvement, or justification. So why do we need further education? So based on the results of this, we need additional training on X, Y, and Z. Or if we're looking at quality control or other processes. Our evaluations can also help us identify strengths and weaknesses. They show accountability. So again, if we said we're going to learn or teach something, then we need to show that it actually worked. Tells us if our objectives have been accomplished, and again helps us evaluate the effectiveness of the method of training itself. So not only are we evaluating, for example, the employees and did they gain the new skill, but was this the right way to teach them? So first we have formative evaluations, and so these occur before or during the learning activity, and we use observation, interviews, or surveys. And so what this is really for is to help diagnose problems or improvements. And again, we perform this at frequent intervals, and this is essential for tailoring intervention strategies. And so in essence, the formative evaluation is not so much the sum total of your knowledge, but instead it's how are you doing. And so one of these is the, give me one example of something you struggled with, or what was something that was least clear to you and most clear to you, where, I'm not so concerned about test scores, numbers, data, so much as it's getting information for what do we need to work on more, or we're already good at this, what do we need to work on less. Now we have our summative evaluation, which is a summary of your knowledge. And so this is done at the end of the term, course, or a learning activity. So this appraises results, outcomes, quality, outcome, and worth. Again, this is quantitative in nature and helps us judge the effectiveness of learning, aka final exams at the end of the term. How much knowledge did you actually retain? So first we have our norm referenced methods. And so here we're looking at the typical performance of a group. So again, this is what you'll see with things like percentiles, which is compared to everyone else, how did you do? Now a summative evaluation or a final exam can be norm referenced or criterion referenced. So you could be compared to your classmates, especially if there's a kind of curve. Or if you're taking things like the GRE or other RD exams, etc., there's going to be a percentile. Or there can be an absolute with a criterion reference. Next we have criterion referenced methods. And so we use this when there's a basis for a level of proficiency that's required, and this compares an individual with a predefined objective standard of performance or a criterion. So it's just this is the cutoff, this is what everyone has to make. So this is more diagnostic in nature and indicates what a learner can and cannot do. So in essence, we're comparing your performance to an absolute and not to your fellow classmates. And so again, for certain techniques or things like CPR, again, if the whole class is bad at CPR, that's not okay. It's just either you can do the CPR or you can't. But we all failed. Well, that's not good, right? Whereas if we were looking at, for example, a exam and everyone did poorly, again, looking at that norm reference, we know there might be a problem with the exam. Whereas something like CPR, where we have a criterion of how accurate you have to be with the CPR, because again, CPR is consistent, the methods do not change. There's a level of performance that has to be done. Other things we can evaluate is not only did the participants or subjects do well with the learning, but what was their reaction. So we have to measure and determine what needs to be evaluated. But we have our hedonistic or happiness scales. And so this is your classic, did you enjoy this? Did you not enjoy this lecture? How likely are you to recommend this training to a friend? And again, so the judgments are subjective, but again, we're looking at those impressions. Now again, part of it does include your audience, so who you were teaching to, how they would receive it, if they thought it was, if they enjoyed it, if they didn't like it, if they thought it was appropriate, etc. But again, you've probably filled these out before. So again, this is that classic, how likely are you to recommend this? How much did you enjoy this? Etc. Did you think this was a good value, etc., etc. We can also look at behavioral change. And so again, looking here at, for example, in continual quality improvement. Now, this is a little bit more difficult to measure, but for example, if we want to look at a change in employee behavior, probably the most famous one is probably things like absenteeism, which is if we do health education and health training with employees, right, they get gym memberships, etc., then they'll have, again, the behavior being absenteeism, we can monitor this. So this can be done selectively. This can be done with direct observation. We can just look at reports. We can do self-reports though, so based on how the employees were feeling, or there's other indirect outcome measures. But like I said, it's a little bit difficult to measure unless you have a clearly defined behavior. But like I said, the most famous one is probably going to be absenteeism, which is, when we have improved access to time off, gym memberships, good health insurance, right? Then what you'll find is, people take better care of their health, and the behavior absenteeism is actually lower. Now again, looking at it from an organizational standpoint, so again, did changing the employee's behavior though on the job improve business? So again, going back to the previous one and looking at employee behaviors, if I had decreased absenteeism, did that improve the productivity of the company as a whole? Does that improve the business? And I think we would probably say yes, so that is useful. But if we went through all this trouble, but it didn't actually help the company, right, then, from a pure business standpoint, it wasn't very useful. Now again, it may still be altruistic, and again, there may be unobserved benefits, but depending on how accurate or how valid, and we'll talk about those terms, that tool was, again, maybe you see benefits or not. Now what we're most likely evaluating is learning, and so looking at the learning of principles, facts, attitudes, values, or skills. Again, these can be evaluated on an objective basis. So again, we wrote our learning objectives, and so again, you should be able to list this, and there's a list of 5. Either you can or can't do that, or you're 80% or 60% or what have you, or you're able to perform some physical skill and I can observe it. So learning objectives, again, provided that measurable performance, so you should be able to list something, you should be able to evaluate something, etc. But we know that a teaching program is not effective at learning, right, if it's not meeting those objectives. So at the end of the training, if they're not able to list the 5 things, if they're not able to demonstrate the thing, if they're not able to evaluate something, right, whatever those predetermined objectives are, if at the end of the session the learner can't do that, then the session wasn't effective. Other things, though, that can be measured, so we have things like physiological or biological measures, so things like lab values. Again, behavioral changes, things that are observable. We have psychosocial measures or environmental measures. Now there's several different data collection techniques, including tests, questionnaires, interviews, visual observation, job sample or performance tests, simulation, rating forms or checklists, individual and group performance or behavior measures, and self-reports. So tests, and again, this is what we're thinking of as probably the traditional written test. And I know things are changing though with technology, but again, this is very common for measuring learning and especially things in the cognitive domain. So very appropriate with school-age children, but less appropriate for adults. Now again, when we're talking about things not school-related. So for example, at work, it's probably not appropriate to just test someone after they're on the job training. So, if somebody works in a restaurant, again, a written test versus can you perform in the kitchen, we can see why this written test is just not as useful of a measure for performance. So we have questionnaires. So again, here we can look at attitudes and values, but again, it's not an objective standard of right and wrong answers. So this is, how did you feel about this or this? Agree, strongly disagree, strongly agree, where again, we can determine attitudes and values, but there's no right or wrong or objective standard. With interviews, again, we're looking at both cognitive and affective objectives. So again, knowledge as well as attitudes and feelings. But for accuracy, right, we need to pre-plan the question. So this is not like counseling where it's kind of open-ended and wanders. We have pre-planned questions. This is more time-consuming, but this can be appropriate for certain topics or for patients or subjects with lower literacy or that are less educated, because again, we're not having to worry about the terminology on the test. It's more of, if we ask the questions, right, what kind of responses are we going to get, and then using that information. So we have observations, and so again, typically if you're looking at some kind of task, so there's defined what they need to observe, there's a checklist, and so again, we're evaluating the performance using what was taught as the standard. So if I taught you to run the cash register this way, so first you scan the item, you transfer it from here to here, you then enter these steps, right? I just observe you, you complete the checklist, did X, Y, and Z in the order, done. So we have the performance test. So it can either be direct observation or simulation. And again here with things like cognitive or psychomotor objectives. So again, this could be recorded for, again, review later, or again, this could just be done instead of actually performing the job as, again, a simulation, but again, for things like tasks. So the book, for example, uses how to use a meat slicer, where again, we can actually determine and go through the steps. How do you use the handguard for safety, etc. So we have rating scales and checklists. And so here we can evaluate learner performance and teacher effectiveness. But again, for looking at that, we have to define the categories, the attributes that are going to be measured and recorded, and the terms. And so again, it's kind of like an observation, but more in depth with each individual task and how each individual task is being done on a scale quality. Now the problem is you need to train the evaluator. So again, does everyone agree on what a perfect performance looks like, or a mostly perfect, or you've heard the infamous, well, no one's perfect, so no one ever scores 100. So we need to make sure that we do train the evaluators so that they're scoring correctly. So we have performance measures, and so these can be individual or group measures, but again, this is going to depend on the specific topic that's being studied. The examples are provided in the book, for example, though, are absenteeism or number of grievances. Again, these are things that are objective and can actually be quantified. We also have self-reports with things like self-evaluation and self-monitoring, and these can be used to measure behavior change, but responses may be distorted or biased, so it depends on that individual's ability, right, to give a non-biased judgment about themselves. And so again, going back to looking at our rating scales, right, it's very likely that people do have things to improve on, but again, are they able to have that accurate depiction of themselves? Now, when we design a test, the first thing we need to look at is validity, and that is it measuring what we intended it to measure? Now here we have, again, it can be content related, construct related, or criterion related. So again, for example, with medical tests, if I want to measure the amount of calcium that a person is eating, I can measure their food and measure the numbers in their blood. And again, that's a very valid way of measuring calcium. Whereas if I'm wanting to test something, so for example, for knowledge, the questions on the test need to be reflective of the material that was taught. Otherwise, it's not very valid. Now, we're also concerned with reliability, or you might hear the term precision, which is looking at consistency with which a test or device measures, which is, does it measure the same every time? So for example, and I'm just making this up, if the lab results have a very high rate of error, or the number is incorrect half of the time, then while it may be valid, it's not a reliable test. Now, if we get the same results, so if, sometimes if you have a poor quality, for example, scale, so if you step on your scale, then you get off of it and you step back on it, and the number changed 10 pounds. The scale is valid in the sense that it is still measuring the force of your body, the force of gravity on your body, but it is not reliable because it says different numbers every time. If I step on the scale and I step off the scale, and I step on the scale and I step on, and off and on and off and on, and I get the same number every time, that is a very reliable scale. And so looking at lesson plans, again, the text turns this into a very short page, realizing that there are entire courses on lesson plans. But in essence, this is a formal write-up. So again, summary information about the instruction. Again, it'll have information about the pre-assessment or needs assessment. So again, is this your pre-test, or how you're going to determine what the audience knows? Again, it's going to contain the performance objectives that we've talked about, along with the content outline. So again, the material that's going to be presented and how it's going to be presented. Again, it'll have the sequence of the content, so how the information will be taught, specific activities that will be used to meet or reach those objectives, including techniques or methods of instruction, along with those educational materials, visuals, media, equipment. Like I said, now in the age of PowerPoint, it's a little bit more of, what slide deck you're going to use. Are there handouts that go along with it? But again, there's entire courses when it comes to lesson plans. We'll also include things like the amount of time needed, facilities, or what space would be needed to teach the lesson, methods to evaluate the results or outcomes, so is there a post-test or a demonstration, and again, references or where the source material came from. And so with that being said, I thank you for your time, and I look forward to your questions.